And privileged and really humbled I am to be here today. It's just amazing what everyone is doing, and there's obviously such a need for this, as we've seen. Toby, massive shout out to you for coming along today. It takes a lot of guts to get up here, so really well done. But this is the reason why we're here, is to really help people and to give them a quality of life. So I'm here just to talk through the MindTech XR programme. Has anyone heard of it? Just so there are, okay, so a few people. Oh, okay, well that's good, because I was kind of thinking, oh no, probably know all about this, but good. Hopefully this will be of value. So the reason why we set up the MindTech XR programme in 2022 was obviously to tackle a real key society problem, which is the ever-increasing gap between the demand for mental health and therapies and treatment, and also the provision of that throughout the UK. So we've just got some stats up here. You probably know these already anyway, but it just shows that the incidence of mental health illness is increasing, and the issue with that is it's being sustained. So obviously we saw a bit of a peak in COVID, and that is being sustained. So it's a really big issue for society. In terms of our programme ambition, what we want to do is invest in extended reality, deliver digital mental health therapies to treat more people more efficiently and more effectively. And that doesn't mean just replacing traditional therapies, that means kind of using it as a tool to enhance those therapies. And we really want to create a supportive ecosystem to make sure that those great innovations that are happening out there are brought to market, but not only adopted, but really stick in the marketplace as well. So why XR? I think we can all see, especially from today, the huge potential that XR has in supporting mental health. There are so many different technologies that go into immersive technology, and that really says to me that there's a really broad application, so it can be used in so many different ways. And delivering therapies remotely, as you know, I mean, we've got some stats up there, so it can be 2 to 3 times cheaper than traditional treatment. It can help to cut wait times. It can bridge the gap, so it can help people self-manage until they actually get their appointments. And it can improve reach and engagement, so we can reach a wider audience and engage with them in those immersive experiences. So our aim is we have a world-class XR sector here in the UK, and we plan to utilise that. So looking a bit more at the detail of the MindTech programme, there are actually 3 work streams, and we have an overall programme budget of £20 million. So that's spread across 3 different areas. The first one, and one of the most important areas, is obviously the grant funding we provide. And this is aimed at business-led research and development. A lot of the time, the businesses actually collaborate with academia as well, because what we're looking for is that really strong, robust evidence. The second bit is all about investment partnerships, so that our grant funding and the public purse only goes so far, so we need those investors to come alongside to boost the funding, and normally it's match funding, so it's 50-50. And also we're hoping to catalyse that kind of like investor market as well. And the last thing, and I'm very pleased to say this was just announced last week, we are now partnering with HINSAF London Health Innovation Network, and we're creating a community of practice and innovation support programme to support not just our project investments, but also the wider XR sector as well. So we'll be doing things like knowledge sharing, so sharing best practice, lessons learned. We'll be accelerating the adoption and trying to help them scale across the UK. And importantly, again, that stickiness will be making sure that the marketplace, like they have longevity within the marketplace and that they stay around. So our first competition that we ran was back in 2022, and it closed in October. And as you can see from the scope, it was for business-led R&D projects, working in immersive technology, and obviously to support mental health. We committed £3.1 million to 29 projects. 12 of those were feasibility, so very early stage, looking for proofs of concept. And then there were 11 industrial research, so they're a bit later on, and they're ready to scale. And all of those should be complete by March 25. Some of them have already closed out, so we're already seeing some impact there, which is brilliant. Some of the examples, you've seen a really brilliant example, so I'm really glad to see the XR Therapeutics team here today, because they are one of our funded projects. Excellent work, thank you so much. But it spans everything from like generalised anxiety right the way through to the phobias that XR Therapeutics are working in. But what's next? Well, the plan is really to expand our portfolio via our investor partnership scheme, and there are 2 further R&D competitions. The first one is actually in progress now, and I've been sitting in on interviews for the second strand, which is industrial research. Feasibility is already sorted and done, and we would hope to actually be able to announce those successful projects in May 24. There's a bit of a lag because obviously we have a lot of due diligence, which is natural for the public sector. I actually come from the private sector, so this is my first public sector role, so it's been really, really fascinating. And then our third competition, and this is something that I'm announcing today, will be running in September in 2024, so I'm very excited about that, so please do spread the word. A lot of the projects that we have funded today have really focused more on well-being and kind of like anxiety, so we do see that there is scope in the future for focusing on more serious and severe mental illnesses and that kind of area, but we are still in the scoping phase, and lots of internal meetings with strategy, horizon scanning. So yeah, we'll please keep an eye out on the Innovation Funding Service, and also we do have a web page on the UKRI website as well that you can refer to. So yeah, I just want to say a massive thank you and a massive personal thank you to all of you for working in this area. It's something that's very personally important to me, and I know a lot of people, so thank you for your time.
Dr Aislinn Bergin from the University of Nottingham, a part of the MindTech team still, yes?
Yeah.
That's great, yeah. Those of us who've been working in digital mental health for a while are very familiar with Aislinn's name, and you might be as well. She's produced some really exciting publications and a lot of work around the development, the implementation and the evaluation of different digital mental health interventions in mental health care and also outside of the clinical environments as well. So it's very exciting to hopefully hear a little bit about that and what's got going on at the moment. So thanks, Aislinn.
I'm also part of Responsible AI UK. So I sit across immersive and emerging technologies for mental health. And I've been working in this space for quite a while, so really interested. And my first slide is sort of this report that Jane alluded to, which is the growing value of XR in healthcare in the UK, which myself and my colleague, Dr Michael Craven, who's over there, were part of. We were also really pleased to be joined by UKRI, Rescape, NHS England, Story Futures, and a couple of other colleagues on that. And essentially what we wanted to try and kind of capture, so this was the start of 2021, we wanted to capture kind of where is the potential for XR in healthcare. And we did that by doing a couple of case studies in different areas, and one of the most promising, but the most significant potential was in mental health. It didn't necessarily mean that it was mental health in mental health services, But some of the examples that we found were, for example, using relaxation just before surgery to encourage people to actually go through with the surgery. What we realized is that there was a big sort of problem with people not engaging, people dropping out, people not coming. We kind of costed this in a podiatry scenario and found that we could actually have really huge savings in terms of reduced resource use and more engagement, reducing that DNAs. The other area that we looked at is whether or not it being delivered in different kind of environments was going to work. And what we found was that different contexts, it seemed to work quite well, but there was a bit of a barrier in terms of what people thought about XR because it was quite new. We also did a systematic review more recently to look at the health economic evaluations and cost effectiveness, and we found that again, if we can reduce sort of staff time, if we can reduce pressure on different types of services, if we can reduce DNAs, then again, it's very effective. We also have been doing some work with Manchester Metropolitan University. They did a seminar in early last year where they basically got together a couple of stakeholders and discussed what some of the challenges might be. And I think we've sort of discussed a lot of these today. So, things around the lack of awareness of XR and what its potential is. Some of those kind of issues around ethical concerns, business cases, regulations, standards. But there was also discussion around these opportunities to develop case studies. The NHS likes stories. How can we develop case studies that show how effective it can be? We also recognize that there's a need for training, a need to co-design as well, and that can help us kind of overcome some of those issues around safety and data and regulations, and making it more sort of personalized to the individual. And we did another workshop then, I made this with AI by the way, we did another workshop in October of last year, and there we sort of brought together some of the big players. We've got NIHR, we've got UKRI in the room, we've got ICO, NHS England, and we sort of said to them, right, brought you all together, what are some of the kind of issues around policy and regulation that we might be able to kind of tackle going forward? What we realized is that there were still many of the same challenges that were highlighted, and they were very aware of these. But by bringing these together, we really recognized that there's an interest in delivering change. So there were actually some examples going on, for instance, UKRI funding this area. MHRA and NICE are in the process of working under a Wellcome funded project to look at regulation within digital mental health, so they're very interested in understanding more about the challenges specific to XR. NHS England are also doing some work on procurement, so they're looking at how do we create a procurement pathway for XR specifically. They're starting off in simulation and training, but with the intention of then going into interventions and treatment. They also recognize that mental health is the area that they are most interested in still, which is great, because that's the area I work in. I promise I didn't prime them at all. But one of the things that NHS England talked about was this need for training. So it's nice to know that that's recognised, the digital literacy, not just of staff, but of services as well. The ICO also recognised that they need innovations to explore data regulations. So people who are working in the space, they would like to work with you and think about what are the challenges in terms of the legislation and things like that. Let's see if there's anything I'm missing. So yeah, the other area was how do we sort of work more across these different sectors, across different disciplines, because that's what we need, Even in mental health, within XR, we need to be working with computer scientists. We need to be thinking about the kind of acceptability and user testing words that are maybe not so used within psychology and healthcare. And so I think it's about developing pipelines, not just in terms of the development, but also thinking about how we develop pipelines for evaluation. So when we're doing an RCT, alongside that RCT, sort of embedding different ways of thinking about implementation, thinking about usability, thinking about the people and why they would want to use this. And that goes across the different systems as well. So I'm going to be doing the panel later, so I've got lots of great questions, I'm sure. And yeah, I think that's sort of a summary of some of the challenges and opportunities and maybe some of the examples that are happening out there that could really provide something in this space. So thank you.